Hi guys, I'm Dr. Andrew Iraniha, and today I'd like to talk to you about how the diastasis recti affects your core strength. For a long time, diagnosis of diastasis recti was considered harmless. But in this video, I'd like to share with you how the diastasis recti really affects the patient's quality of life. First, let's define the diastasis recti. There are two large parallel muscles in the center of the abdomen called the rectus muscles or six-pack muscles, which are covered with a very thick sheet of fascia and connected to each other in the center of the abdomen. Diastasis recti is a condition where the connection gets loose and the two muscles separate from each other. This condition is common in female after pregnancy, but it also can happen in men and non-pregnant women due to a variety of conditions such as obesity. Even though the two rectus muscles are separated from each other, but they are still connected together with a thin fascia in the center. Therefore, unlike abdominal wall hernia, the diastasis recti does not have a risk of bowel incarceration or strangulation. However, the diastasis recti can affect the core muscle strength in other ways and could be associated with the various forms of issues. To understand these issues, first let's talk about the abdominal wall anatomy. The abdominal wall on the side has three main muscles called external oblique, internal oblique, and transversus abdominis muscles. They are all originating from a thick fascia in the back and insert into the midline rectus muscles. Therefore, when the rectus muscles are separated from each other in the diastasis recti condition, these abdominal muscles on the side do not have a strong anchor to contract, which makes their function inefficient. This lack of efficient contraction could also lead to partial muscle atrophy and weakness. That's why a majority of patients with diastasis recti complain of lack of abdominal core muscle strength, abdominal discomfort during exercise, inability to perform core exercises, and lower back pain due to abnormal body posture. In summary, even though diastasis recti is not associated with a life-threatening complication, but it really could affect the individual quality of life and needs to be addressed. At Surgical Oasis, I have expertise in all available surgical techniques to repair the diastasis recti, and a comprehensive examination and surgical discussion would be provided prior to the surgery to customize the best surgical option for each patient. For surgical consultations, please contact my office at 949-646-8444. Thank you.